So this month we're talking about foot health and different foot conditions. We see a lot of people that come into the clinic with some acute and chronic pain in their feet, and that can be caused by a whole variety of things. We can have everything from Achilles tendonitis causing heel pain, heel spurs, we get plantar fasciitis, we can have pain due to bunions, we can have issues by something called Morton's neuroma, which is a compression of the nerves in the foot, which causes a lot of burning. A lot of these problems are actually caused by similar issues, and that's biomechanical problems with our feet. When we look at our foot, we want to make sure that we're maintaining a good, healthy arch. I don't want to have too high or excessive an arch, and I don't want to have a flat foot. But my foot should be mobile. A good quick test to see if you've got good foot mobility is if I stand with my feet side by side, and if I rotate my entire body to the right, I should see my arch on my right foot forms bigger, and that the left foot collapses a little bit. And when I go to the other side, I should see the reverse. We see some people that may have normal looking arches, but their feet are very rigid. There's not a lot of movement. And because we bear a lot of weight, I have to have kind of that elastic, springy effect to my foot. So the best thing to do if we have foot pain or if we want to prevent foot issues is to get assessed and see, do I have good arch height? Do I have control of my arch? Do I have a good mobile foot? We see a lot of people where the mobility of their foot is terrible, and so we make recommendations all the time to use either a golf ball or a lacrosse ball. Just like we would with a foam roller, we want to try to roll out the bottoms of our feet. So I can use this ball to try to find any tender spots in my foot and try to break up any of those adhesions. I can even go as far as getting a little spiky ball to try to get even deeper if I feel like that's not being effective. But again, even someone who doesn't necessarily have foot pain but might get tight calves will probably be surprised at the number of tender spots that they feel in through their foot. We don't just want to have the tissue be loose, but I got to make sure I have good control of my foot. So we talk a lot for health of our upper body about having good grip strength. So again, we've discussed this in previous videos, but I want to make sure that I can control the position of my foot. I'm a good kind of case study for this because while playing football, I wrecked my right ankle. So if I stand completely neutral, this is the upper limit of my left arch, and this is the upper limit of my right arch. So that's significantly different. I've got probably about 3/4 inch difference. So the question is, do I have enough control of the muscles of my foot to elevate my arch without curling up my toes? So I want to make sure that I've got that good position of the arch and that I can control that with the muscles of my foot. So if I'm standing in line at the grocery store or talking with somebody, I can be aware, have like just 2% of my brain aware of the position of my foot. If I can't do that, but I've got biomechanical problems with my foot, then I definitely should be having some kind of orthotic therapy, using an orthotic in the shoes that I'm going to be spending most of my weight-bearing time. So we believe everybody benefits from having at least one pair of orthotics, even if I'm just keeping that pair of orthotics in my golf shoes or the dress shoes that I might stand in a lot at work, or the running shoes that I might wear if I'm going to be doing a lot of mileage, doing cardio or doing a lot of running. Because very few people can control that position of their foot perfectly all the time. So we're going to go through a case study to show exactly how somebody with really chronic kind of foot and ankle pain really just comes down to biomechanical positions of the feet, and we'll show the difference between that person relaxes, what their foot looks like, and when they actually take active control, how they can change the position of their foot, and then realize, do we think they can do that 24/7? Probably not. So the orthotic is going to be there to help them when they need it, but we're going to continue to work on the strength of the foot and the positioning of the foot, so long term they can improve the actual function of their foot themselves. So even though when they're walking barefoot, not in the orthotics, they're still going to have better results and less pain.